Welcome to the Essence of Health Tea Time podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. On today's episode of the Essence of Health Tea Time podcast, I have a special guest, Dr. Byron Jasper. Hailing from Houma, Louisiana, Dr. Byron Jasper is the esteemed founder and chief executive officer of Baia Clinic and a proud alumnus of Xavier University of Louisiana. Dr. Jasper earned his medical degree from Tulane School of Medicine, complemented by a master's degree from Tulane School of Public Health and Tropical Medicine. He completed family medicine residency at Baton Rouge General Family Medicine Residency Program and is board certified in the specialty of family medicine. Dr. Jasper has extensive expertise in the field of family medicine, community health leadership development, and HIV and hepatitis care. In addition to his clinical work, Dr. Jasper is the author of the widely praised book, Baia Blueprint, an introductory guide to direct primary care for doctors, patients, and businesses, where he offers an insightful and accessible exploration of the direct primary care model, which has resonated with both healthcare professionals and patients alike. Beyond the practice of medicine, Dr. Jasper aims to enhance public health in vulnerable communities by reducing health disparities and promoting healthy lifestyles. Welcome to the show, Dr. Jasper. I'm excited to have you here.
Yeah, thank you for having me. And amazing bio. Almost sounds like somebody important, almost, right? Not quite there.
Who is that person?
Right, exactly. I'm like, did I do that? That can't be me, right? Yeah,
Right,
but no, thank
right.
you for having me. I appreciate the opportunity.
Yeah, for sure. All right. So we're just going to really start with the basics because I think, a lot of folks just really aren't even aware of what the prostate gland is, nor even what it does. I've had even some women ask me about their prostate gland. So if you can just even give us the basics about the prostate gland.
Yeah, so real simple. The prostate for most males, when we have the conversation, I tell them is basically a gland that is for most part sexual health purposes. It does something that allows when you're sexually active to basically make the fluid that comes out, sperm, work better, is basically the simple way to say it. You can get obviously more technical and seminal fluid and all these big medical terms, but to keep it simple, which is always important when you're having that discussion, it's basically when you're sexually active, it makes the sperm work better. If your prostate does not function, your sperm does not do what it's supposed to do. And then, of course, if you're trying to conceive, it could be a problem. Or if you're trying to enjoy sexual activity, it could be a problem. So the idea for the gland is to hopefully be healthy enough that when you are sexually active, you are enjoying and able to achieve the goal that you are trying to achieve, which most people is trying to be have a pleasurable experience. So we really want that prostate to be healthy, not just because it's just something there and you really don't know what it is and don't know what it can do, but we really want it to be where if it's working, it does all the things we ask for it to do.
Yeah, yeah. And that's a great explanation there. So, ladies, this topic, while it's not exactly for you today, it is for the men in your life, whether that be a partner, a spouse, a brother, uncle, whoever. It's for them. So
Yeah.
keep listening and pass it along.
Yeah, well, I'm going to jump in and say
Yeah.
it definitely is for them as well, because as you just said, they have those significant others and those family members in their life. But in a very weird way, people will realize that if you're really in a family setting, whether it's a spouse or whatever, this can impact you as well. Obviously, we'll probably talk about it, but one of the things I've had with patients is the man doesn't complain about the problem because they think it's normal, but the wife will say he keeps getting up in the middle of the night to go to the bathroom. And when he gets up, it wakes me up. And I'm like, well, that's not normal. We should talk about it, right? So in a way, it can affect the woman in that, daytime, nighttime, you're tired because he's getting up all the time. So in a domino effect, it can kind of have that downstream problem. So I will say it does have some. It's not directly, but indirectly it can.
Yeah, for sure. Yeah. And thanks for pointing that out.
Yeah.
Now, when we get into the screening guidelines of the prostate, what are the most current screening guidelines for prostate cancer? Because, I've been practicing since 2010 and they've even changed since then. So give us the most recent.
Yeah, the ones that I usually tell people are when you're talking about when do you get your prostate checked, I usually say it depends, and that it depends on who you are and what are we potentially looking for. So just general prostate screening to look for prostate cancer, you're talking about starting around age 50 for most, but if you're African American or Black, you are going to potentially start earlier because it in essence impacts Black people at a faster and larger rate than it would if you are a non-Black person. So 40 to 45 for Black people, 50 is usually a safe place to have it. Outside of those two, the screening itself can be done with either a blood test or what we call a DRE, a digital rectal exam. I often tell males that I don't think anybody really wants to do the rectal exam. I know I damn sure don't. I don't wake up excited to say, you know what, we're doing that today, but we do it because we have to. If we do not have to, because we do a good job of discussing risk factors, history, and all the things that come along with prostate screening, we may not need to do a rectal exam and we just check your blood test. And then obviously keep an eye on that blood test by trending it out over a couple of years or a couple of decades, depending on how long you're going to be patient in that practice. But oftentimes people get nervous because the first thing they think is, I have a prostate exam. It always is a rectal exam. Rarely do we have to do that if everything else checks out. You don't have a lot of risk factors, you're in the right age range, and we're checking that blood test regularly. You may not ever need one, but in the event we do need one, we just need to get it done because it's better to get it treated early so we live a long, happy, healthy life rather than not screen, not do anything, ignore it, and then all of a sudden we're getting really sick at an early age.
Yeah, yeah, exactly. And really what you said for me highlights the point and the importance of folks having a primary care doctor and, one that they've really developed a relationship with and one that they trust because the way things have shifted in the world of, prostate cancer screening is really that discussion piece is so important, even in the direction that you would go in for the screening. Folks like you and I with direct primary care type of practices, for us, one of the things I know me as a physician that I enjoy about my practice is I get the chance to have those deeper discussions with my patients. And this is just an example of why that's so important.
Yeah, absolutely. And the idea is you have more time, you don't feel rushed. And of course, you have the ability to really explain what the prostate is, what it does, what it doesn't do, when to use it, when not to use it, when to get checked, when not to get checked, how to get checked, rectal exam, blood, like all of that takes time. Now you can squeeze it into a quick 5-10 minute conversation, but you're leaving so much out that a person can potentially get confused and think, well, look, I had a colonoscopy, so I don't need a prostate exam. So now we're kind of having the ability to say, what's the difference? Why are both important? When do you need it? When do you not? And that time is so much more valuable than people will really and truthfully give it. They think, I've had patients literally be in a visit for almost an hour and a half, and they think, oh, we only been here 10 minutes. And I'm like, no, we've been talking for about an hour, and you're still having more to discuss, which is great. We can obviously get you rescheduled really quickly. But that point goes to show that when you have time, more discussion happens, more health is being built from a mental health, physical health, financial health, just comfort level gets better and everybody feels better overall. So this is one of those prime examples because it's such a small gland, but usually takes a lot of time to really get into why are we doing what we're doing and how do we keep it healthy.
Yeah, yeah, for sure. And then it helps, for the comfort level of that patient. You mentioned a lot of men are not comfortable with getting that digital rectal exam. And I can imagine, going into the traditional 15-minute visit, which really turns in about 7 minutes that they actually see the doctor, and you're getting
Correct.
a drive-by, rectal exam. That's not gonna be very comfortable.
I don't think I've ever heard drive-by rectal exam. I think that's a good one. I'm gonna have to go ahead and possibly use that in our promotion of, do you really want to drive-by rectal exam?
Right,
And
right,
most people are
exactly.
gonna say no. So I think we're on to something. So we need to
Yeah.
trademark that, Shayla.
Right, right. Yeah, yeah. You want that relationship for
Okay,
sure.
there you go.
And now, as a fellow African American physician, we know the importance of being mindful of the impact that certain conditions may have on people of color. So, how does prostate cancer particularly impact men of color, and how does the conversation that you may have with your patients look with this in
Yeah.
mind?
Yeah, so I think for the men of color, the conversation I have, and we kind of spoke about it briefly earlier, one of the things is that we tell patients that if you're an African American male, you're going to have more likelihood that patients are going to need things done sooner because those exams are oftentimes neglected just in general because they're uncomfortable. And if they are uncomfortable, we're having issues where you don't want to do them automatically, let alone you're not actually engaging with the idea that you need them done earlier, right? So you're thinking, look, I got to wait till 50 to do this. So I'm just going to put it off because, hey, 50, I can wait to 55, I can wait to maybe 60. So I'm only 10 years behind when in actuality, you're 20 years behind because you're supposed to get it done at age 40. So having the understanding that some disease processes are going to affect men of color a lot differently than it would if you were someone who is not in that category is important to getting the best result. So a lot of our patients will come and they're in their late 30s, and I give them what I call the notice. The notice is like, look, in about a year or two, we're going to have a conversation about your prostate. Or, hey, we have not talked about your prostate, but that's going to be at your next visit because you're going to be in this age range, right?
That's a good
Or,
idea to
hey,
kind of get them mentally preparing for that before.
exactly, right? So having that conversation proactively sometimes lowers that guard, right? Like, I don't want to talk about this, but more importantly, like, hey, I go home and more than likely tell the woman in my life, hey, they told me I need to talk about my prostate. And that probably puts them in the conversation as well, which also is very helpful because now it's a family discussion rather than a silo discussion of they said something about a prostate or something and they walk out the door. It's a lot more detailed of I'm giving you notice that your next visit in a year, in 6 months, in 3 months, in a week, we're going to really talk about this. And that person of color oftentimes appreciates the idea that we're going to have an actual visit for this and it's going to be a prime focus. So I highly encourage getting in care, in primary care specifically, but I highly encourage the idea that if you're comfortable with someone who's going to acknowledge that, hey, you're a person of color, you do have to think and do things slightly different because that's just the way it is, especially in the country that we live in. And health is no different. And if we are very proactive at doing things, you're going to probably have a better outcome than if we just kind of do it as quote unquote everybody else does.
Right, right. Yeah, that's true. I'll tell you the story. I had two patients, and this was just within the past couple of years, both Black males. One was 40, and we had that discussion at 40, and they actually didn't have any family history of prostate cancer, but he was at this point of life where he was really wanting to just, take better care of himself and just be more in charge of his health. And so after we had, the risk benefit discussion, we did check the PSA. Turns out it was pretty elevated, and he did, I sent him on neurology, and he did in fact have prostate cancer that was caught early, thankfully, and he was able to get proper treatment. And then the other Black male patient that I had, he was a bit older, he was closer to 50, but kind of same situation. He did have a few symptoms, which is why we went ahead and checked, but he hadn't had it checked before even at that point. And same deal, he had prostate cancer as well. So just, even as you said, just with, these two different cases, one with family history, one without, younger, but still at the age of 40, and both being males of color, it's so important to be aware and to, have a doctor who is going to have this discussion with you.
Yeah, very knowledgeable doctor, of course,
Yeah.
needs to be in the room with you. That usually helps to mitigate a lot of risk. And you hit on some of the things that I think a lot of men oftentimes don't know. Women may not know, obviously, because they don't have prostates, but they tend to know a little bit more about health, even men's health, than the men do. But those symptoms that are often ignored are the other thing, right? Not only knowing risk factors are higher in men of color, so we screen earlier, but hey, what are those symptoms, right? So as you just mentioned, basically it's the common things that most people may think of, which is, hey, I'm not able to perform the way I'd like to when I'm sexually active. So we'll say, if you want to wrap it up, it's erectile dysfunction. That
Right.
is the common thing that a lot of people just basically brush off, right? Men don't want to talk about that they're not performing the way they want to or the way they used to. They just assume either I'm getting older or it just happens. And it could be a diagnosis of a prostate problem. It may not always be cancer, but it could be a problem. So that's one of the biggest ones that I always tell people, if you're having this, we need to check your prostate numbers, maybe even check your prostate with the rectal exam. The other ones, of course, are just urinary symptoms, which are the little bit more common, which people will say, okay, I'm not able to go to the bathroom and urinate like I want to. I'm having trouble starting the stream, trouble stopping the stream. When I go to urinate, I feel like I got to go right back, so I'm not emptying all the way. And then sometimes it's really hard to actually finish going to the bathroom because you're having that hesitancy, meaning you're standing at the toilet and it's just taking a long time to get going. So all of that being said, those symptoms play a huge part as well in the screening, because if you're having those symptoms in your 20s, we want to know why, we want to know what to do, we want to check you even earlier, because there's still a potential you can have something in the 20s or 30s. But if you're having nothing, we tend to start in the 40s. And then, of course, when we do the screenings, we kind of go over all those symptoms as well as just risk factors from your family history, which are important as well.
Yeah, yeah, for sure. Now, what role, when we look at prostate cancer prevention, you talked about some of the risk factors, but what role does even lifestyle factors play in reducing one's prostate cancer risk? And what are just even some things that men can do to improve their health and lessen these risks?
So the common lifestyle things I tell people is, of course, diet and exercise. That's just kind of like the mantra in family medicine and internal medicine. You'll hear people say that if you're eating the right foods, drinking the right things, and basically exercising, you live a longer, happier, healthier life. Another thing that a lot of people are surprised about is eliminating stress, right? When we talk about mental health tends to be one of the things that people think that, hey, if I'm not depressed or anxious, then I just quote unquote feel better. But the other thing is you live longer, right? Your heart's not having as much strain on it. Your brain is not having as much strain on it. Your kidneys and even your prostate are going to have more strain on things when you have high levels of stress, high levels of depression, high levels of anxiety. So we try to eliminate that as a part, because it's kind of weird to say I have no risk factors, but I ended up having bad heart disease, bad kidney disease, and prostate disease, but I didn't do anything other than you were stressed the whole time. So
Yeah.
having
And
that,
Dr. Jasper, I'm gonna hold you even right there, because you
yeah,
mentioned stress, and the studies have come out more recently, even from the CDC, where we're recognizing more chronic stress in communities of color. And so, it just points more to that picture, how we talked about that men of color being more at risk with prostate cancer. And you're right, even without, recognizing these other risk factors, chronic stress is, still likely to be there.
yeah, it is a huge thing for a lot of health. And it's surprising when I tell people, your prostate could be a problem because you're just really stressed out. People are looking at me like, are you making this up? And I'm like, no, it's actually scientifically proven. And the other one that leads into that is sleep. So if you're not sleeping well, that can actually affect your prostate. So of course, the risk factors we always go over don't always match what you're potentially going to do to mitigate those risk factors, because a person may say, well, how do I stop family history? Well, you sometimes can't, but you can do things about what you're putting into your body, what comes into your life, right? Stress and eliminating that. And then how do you take care of your body by getting enough rest to adequately rejuvenate the things that we have done and used all day? I often use the analogy, because I love analogies in healthcare, of when you have a phone and you use it all day, your battery gets low. And what do we automatically do at the end of the day when the battery's low? We charge it, we recharge it, we recharge it, we recharge it. Well, if you don't sleep enough, you're not recharging your battery, and it's just going to get drained until eventually it stops working. So people start to understand that a little bit better and will sleep more. They feel better, their health is better, and they live longer and have healthier and happier lives.
Yeah, for sure, for sure. And thank you for pointing all of those out, because those are very important. And as you mentioned, patients, they probably feel like they get tired of hearing that, but it's because it's so important with those lifestyle factors for just so many reasons. But even just knowing, that getting more sleep and reducing your stress and putting some vegetables on your plate can reduce your cancer risk. That's, pretty huge. So
Extremely,
yeah.
extremely.
If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting. You know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to 𝐒𝐡𝐚𝐭.com to learn more. The essence of health is in you. And now, what strategies do you suggest if patients who, may not have a doctor like you or I right now to communicate more effectively with their healthcare providers about their prostate? What strategies do you mention to those folks?
Yeah, I think in general, prostate is an extension of just health in general, right? Like you should have a good relationship with the doctor that you are getting care from, whoever that is, whatever type of doctor it is. The goal is to have really good, healthy, open communication. And a lot of that is relationship building, right? Like the first time you meet one of your good friends, you probably don't have the best conversation. It's probably a lot of feeling each other out until a certain point where that click happens and you're like, this is a good friend of mine. I feel open. I feel comfortable talking to them about these private matters. The same thing should happen, hopefully, with your doctor. On the first visit, you may not give them everything, maybe not. But as time goes on, you should feel comfortable explaining and having conversation with people to where you are hopefully going to get the most authentic, very genuine answer that helps you feel better. So how do we communicate like that? Well, coming in and being, again, open and authentic is the first thing. But then I think the second thing is preparing yourself with questions and feeling like it's okay for me to ask because I don't know everything, but I do know this is something I want to kind of get more information about. And the goal for us on the physician side is not only saying, hey, I want you to ask, but also being okay for us to tell you, look, hey, we don't know. We can look into it for you. We can figure it out. If we do know, we're going to tell you right then and there. But if we don't, we want to be able to communicate effectively by saying, I don't know that, but we do have a propensity to go and look things up, especially on the physician side. We're trained to go and find answers, even if we don't know. A lot of times we do know, but when we don't, we'll come back and look into it and do that. So that communication has to be on both sides, open and authentic from the patient coming and talking to the doctor. And then, of course, being prepared with questions about things you experienced, feel, and want to know. On the doctor side is being open and authentic as well and saying, hey, this is what I do know. This is what I don't know. I want to be able to give you the right answer. So I'm going to do what I can to tell you right now what I know and tell you I don't know. Go look it up and come back to it. And when that communication flows back and forth, especially in direct primary care, we have a really good time where patients have no problem calling us directly, especially after hours, which is sometimes the best time to have these conversations. But more importantly, sending us text messages that sometimes are to a link of an article, to a news story, to a medication, to a supplement. And we're able to say, hey, this is what I do. This is what I don't do. This is what I know. This is what I don't know. This is where I'm going to tell you to go and get more information. This is where I'm going to tell you I am going to look it up and get back to you. And that authentic, open communication happens in the exam room, over the phone, via text. And that is how I think we get better health overall, especially with the prostate. If you don't know the answer in the question in the exam room, you go home, you talk to your wife, you talk to your spouse, you talk to your sibling, you talk to your uncle, and another question pops up. You just call, right? At that point, you call us and we can tell you, hey, great question. I'm glad you called. I'm going to give you your answer right now. Or, hey, good question. I never heard about that supplement. Let me go look it up and I'll get back with you because it could be something very helpful. It could be something that's not really the best for you. But that conversation is happening in multiple levels, possibly in multiple settings and over multiple days. And what happens with the patients then in this very long-winded, robust answer is me saying, you are going to get an answer that helps you get to better health in some way, shape, or form. And patients love that because they'll say, I can communicate what works for me. Some people may not be phone people. Some people may not be text people. Some people may be in-person people, but we do it all, right? In the direct primary care space, our goal is to communicate, give people the health, meet them where they are. And people love that with this type of discussion, sexual health, prostate, all that. It just gives them that I'm now disarmed. I now don't have to worry. I'm not going to get judged. I don't have to get it all in this 5-minute visit. And if I forget, I got to wait 3 months. It's
Right.
us
So it takes
meeting
that
them where
stress
they are.
out too.
Absolutely.
Yeah, from
Which
that.
is, And I think I'm glad you said that. Actually, you said you're taking stress out, which is what we just said. What we're adding stress to the person and telling them to stop stressing, but we're also feeding the problem in the traditional system. So for us on the direct primary care side, we're eliminating that stress, and people really and truthfully are healthier for it.
Yeah, yeah, for sure. I get a lot of emails from my patients as well. They'll say, send me a link. Well, what do you think about this article? I read this, or
Mhm.
even sometimes, nowadays we get, I saw this on TikTok. So,
Yeah,
what do you think about that?
yeah,
And I've seen even just in forums where some of our colleagues will get pretty frustrated because their time is limited and they don't have time to maybe debunk or look up what you saw on TikTok. But for us, we can dive into that a bit more and say, there may be some truth to that, or probably not, kind of thing, and have more time, and it's not stressing me out, and it's not stressing them out either. We can continue to have those upfront discussions with one another for the overall betterment of their health.
agreed, 100%.
Yeah, yeah. All righty. So before we go, let's talk a little bit about some of those misconceptions about prostate cancer that you may have encountered with some of your patients.
hmm I think one of the most common misconceptions we have of prostate cancer tends to be the adage of, hey, you're going to have a symptom, and that's how you're going to know you have cancer. A lot of cancers, prostate cancer being one of them, are very slow and very, very, very silent. You will oftentimes go years, if not decades, with no symptoms at all. And then when you do have a symptom, it doesn't scream cancer, right? It could be I'm having back pain, or I'm having real, discomfort with going to the bathroom. It's just really difficult to start urinating, or I see blood in my urine. I don't know what that is. So those symptoms are so few and far between for a lot of patients that we will find it well before a patient has a symptom. I have a patient currently, no insurance, Hispanic male who is undocumented from Mexico. And we have discovered his prostate cancer on routine screening with blood tests, and finally got him into a urologist where he's fortunate enough able to potentially get the care he needs, even without insurance, because we know how to navigate a system that will not necessarily be kind to patients with no insurance. So based on that, it was very much if we didn't check for him having routine screenings, it would have been where he would have been with that silent killer, if you will, and we don't
Yeah.
want that. So I think the other misconception, besides it being hey, I'm going to have cancer symptoms pop up, is that it is not going to happen to me. Right. It's just not going to happen. No one in my family has prostate cancer. No one in my family has prostate symptoms. It's not going to be me. Well, I'll say this, no one in your family is you either, right? You could also have a diet different than them. Maybe you're a smoker. Maybe you have
Yeah,
way more stress.
exposure
Maybe
risk
exactly.
different. Yeah.
You have so many things that can affect your ability to stay healthy or not stay healthy that you could be the first. So the idea that I'm too young to have it, I don't have any symptoms, so I'm fine. I don't need to go to the doctor. And I'm sure you get this all the time. I rarely go to the doctor because I'm never sick.
Oh,
Well,
yeah.
that doesn't mean that you don't have something going on. It just means we haven't
Exactly.
seen it yet. We haven't found it.
Right.
That's like
And those
saying,
are
well, look,
usually the patients I end up finding about 10 different diagnoses that just
exactly.
haven't been, diagnosed yet.
Had a lady yesterday. Her first visit was yesterday. No insurance. Literally called and kind of said, "Look, I'm trying to figure out how to get in because I'm having this horrible stomach pain, but I haven't been a doctor in years because I rarely ever get sick." And of course, walks in the door, has high blood pressure, has extreme anxiety, has bad insomnia, has trouble with acid reflux, and we're just running through in one visit 4 different issues that I diagnosed. And literally I'm just sitting here like, this is the healthy person, right? That I don't rarely get sick. So that misconception that people tend to have is that, well, if I'm not checking and I don't feel bad, then nothing's wrong. And again, analogy wise, I like to say that's equivalent to saying, well, I'm driving a car and there's nothing going on. There's no check engine light. There's nothing ever popping up. So I don't ever need to go get it checked, or I don't need to get my oil changed. I don't need to get the tires rotated. I'm just going to drive until something happens. And when that happens, that's when a problem pops up that is so far gone that you have a hard time getting it back to where it should be. The engine is burned up. The tires are really, really, really bad. So you can't stop and you're sliding off the road. So we don't want that. We don't want you to have those negative things happen. We want you to catch it early. And that misconception that it can't be you, we got to wait till we have symptoms, that it's going to be a really noticeable symptom that pops up first. So we will, be able to catch it early. All those are things we don't want to have. And of course, in direct primary care, we have more time to really talk about why we're checking, who we're checking, when we're checking, how cost effective it'll be to check this. because we are very much more knowledgeable of not only the healthcare side, but the business side. And it also gives people a lot more reassurance that we have time to really go into checking all these things and catching them early.
Right. Yeah. And I'll add to that one misconception that I've heard. I don't know if you've heard this one, but for some men, they think, oh, well, that's an old man's disease,
Yeah.
prostate cancer, because they say, oh, I remember my granddad having that, but isn't that an old man's thing?
Yeah.
And not realizing, as we've, discussed today, that as
Yeah.
early as 40, you can be
Absolutely.
screened for this because you might have even had it showing up before then had it been screened. So,
Well, I think one thing I'll say to the people who say it's an old man's disease, and this is me just being me, I tell people, you're gonna get old too, right? I know you think you are young until you hit whatever that magical age may be, but you're old to somebody, right? So if you
right.
have children, you're old or older. So you should start checking as soon as you even remotely think that comes into your mind. Oh, it's an old man's disease. How do you know? It's because you think that you don't need to. How about we just go find out, right? Unless it's going to break the bank and it's just so hard to check, right? Like we just have to do this very invasive procedure. Why don't we just check it? And a lot of times it's so cost effective to check it and not use the insurance, because insurance just runs the bill up so high that you checking a PSA or a prostate specific antigen, that blood test, if we're checking that PSA, it literally will be so inexpensive that we just can check it and just be sure, right? Even in your 20s, a lot of people can just get that out the way, and as opposed to just assume I'm healthy, right? And I'm gonna spin it for a real quick second. I have another gentleman. He works out roughly 7 times a week, eats very healthy, so we think. And with him, physically looks like the person you want a person to look like, right? Low body fat, very muscular guy, does martial arts, all this stuff. Long story short, we check in, his cholesterol's high. And he's
Mhm.
looking at me like, how's this even possible? I work out all the time, and so on and so forth. And I said, yeah, that's the thing. That's the misconception. People think because you look healthy, therefore you are healthy. But
Right.
we know people who are oftentimes looking healthy, but have really bad habits. They drink a lot of alcohol, they smoke cigarettes, they eat very poorly. And my favorite is they also are extremely stressed. They come
Mhm.
in, they smile, hey, everybody looks happy, and then they go home and they're crying in the car, kind of thing, right? All of that affects your health. And prostate, as you just said, is something that can easily get sick and doesn't tell you it's sick. But
Yeah.
because you are thinking or faking the funk, therefore, hey, I must be healthy. No, that's just not how the body works. The body is very resilient until it's not. And when all of a sudden it's not resilient, a lot of times it's too late. So we want to catch these things early. We want to get them to be treated very early, and then we go from there.
Yeah, yeah, for sure. Well, thank you so much for sharing all of this with us. Now, before you go, I do want you to tell us more about your book. Why did you write it? And how do we get a copy?
Yeah. So the name of the book is the 𝐊𝐲𝐵 Blueprint. It is an introductory guide to direct primary care for patients, physicians, and businesses. The idea of the book was basically written for us to get the word of direct primary care out to more people. You and I are in a lot of the same Facebook groups, and we've been to the same conferences. So we will oftentimes run into a lot of doctors who are interested in learning more about DPC, but a lot of times they don't really have all the ins and outs. So the good news for them is they can go into a conference and get some understanding and education on DPC. But a lot of patients, a lot of that comes into them having to talk to a DPC doctor or someone who is familiar with DPC, maybe another patient or something like that, to get that information. So I say, well, it's getting to the point where I'm having to explain it over and over so many times. I wish there was something that could be put out into the world that would have people easily say, if you want to learn what DPC is, this is a good book. It really kind of hits all the high points. It's not into the weeds of all the little small things. Like we're not talking about the lab prices. We're not talking about how we send stuff directly to the pharmacy and how do you set that up, which a lot of books have been written about how to do that. It's more of these are the things that can be done, and these are things that people are already doing within direct primary care. So the patients have an opportunity to learn more about it. Physicians, of course, get to learn about it in the clinic. It also gets taught to them in the conferences, but now there's a book that you can easily take home with you before you even decide to kind of jump into a conference or go into another clinical setting. You can just kind of sit at home and listen and or read and have that conversation with yourself of, look, this model sounds more like something I want to explore further. So that intro guide, as I said, it's really the first step into hopefully what direct primary care can be for a lot of people. And lastly, for businesses, it's a really good book because it helps to show how businesses can save time, save money, keep employees healthy, and keep them from having that missing work all the time because they're so sick. So we really wanted to be that if you want to learn what direct primary care is, here's the book for you. And so far, it's been going pretty well. We've had a lot of people give us good feedback that I really had no idea direct primary care did all of these things. And now that I hear and have read and learned about it, I want to learn more. And that's exactly what we wanted it to do.
Yeah, awesome. Awesome. And I'm glad you wrote it because it's so important for more people to know about it, not just for physicians, but even for families, patients, employers, because so many people can benefit from a direct primary care, being a part of a direct primary care practice. I mean, just, some of the few things that we've even just highlighted today, just in our discussion. So folks, go out and get the book. I'm going to place the link in the show notes to this episode so that you can go grab your copy. And then Dr. Jasper, tell our folks how they can connect with you on social media or online.
Yeah, so simply, website is probably the best place to kind of get the most information about us. That is www.byja.org, which is short for Byja Clinic, which is our clinical practice. We also have a nonprofit division of our practice that is meant to help basically get more services to the underserved who sometimes can't access DPC because of the feeling of having to pay out of pocket, maybe a little bit too much for them. So the nonprofit arm is the Byja Charitable Alliance, and that website is www.byjaca.org. So those are our two websites that we point people to. If you're someone who's local and looking for a male physician, feel free to give us a call, come and see us. If you say, well, I don't necessarily have the ability to see Dr. Jasper, but I want to still support, we are, again, a nonprofit 501c3, so we do have tax-deductible donations that we accept and use for those underserved patients. Outside of that, we're on social media, Facebook, Instagram, and LinkedIn, at Byja Clinic, all one word. And then outside of that, we do have a podcast that we are recording here and there. I say here and there because we kind of put it on pause to kind of get the book out and start promoting the book. But that podcast is Byja Radio, and that is on Apple, Spotify, SoundCloud, and I do believe YouTube Music last that we checked. So we are, again, out there. It shouldn't be hard to find us. If you type the word Byja into pretty much any browser, something will pop up about us. And our goal is to obviously get the direct primary care message out and get more people into care so they have better health and better outcomes.
Wonderful. Yeah, yeah. Well, thanks so much for coming on the show. Folks who are listening, I'm going to put all of those links in the show notes because I do want you to reach out and connect with Dr. Jasper, especially if you're in the Louisiana area. You need a doctor like Dr. Jasper, so go see him. All righty. But thanks so much for being on the show.
Thank you so much, and we really appreciate the opportunity.
Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@𝐒𝐴HWC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.𝐒𝐴Hcoaching.com. The essence of health is in you.